So cancer is, of course, a group of diseases that are truly, truly terrible, that have a really high burden on the quality of life of the patients and the families and caretakers of the patients that suffer from them. And the greatest problem might be that the incidence and the frequency of many types of cancer is actually increasing, despite all of the effort and all of the investment that people do into preventing it and treating it. We are not in the right track. So today we're going to talk about 10 ways we can stop cancer from increasing its frequency and, of course, affecting our lives. First of all, we have to start acknowledging which are the most common types of cancer in the world, thinking that every type of cancer is a different disease, so it might need different strategies to prevent it. Here I present some research done by the Global Cancer Observatory. We can see the incidence, this is the blue line, and mortality, the red line that we can see here, the red bar. So the most frequent, the cancer with the highest incidence, so the highest known number of cases per year, is breast cancer. Then we have prostate cancer. Of course, this may vary from region to region. This is an average from all of the world. In third place, we have lung cancer, and we can see that despite being the third in incidence, it's actually one of the highest mortalities associated, since usually a lung cancer diagnosis is a pretty serious disease from the moment we find it. Then we have colorectal cancer, cervix uteri, stomach, non-melanoma skin cancer, liver cancer, corpus uteri. This means other cancers in the uterus, different to the one in the cervix, and finally ovarian cancer. So, of course, these are the ones that we have to focus to diminish, since they are the most frequent, to diminish the incidence and thus stop cancer in its tracks. And we are going to talk about 10 strategies. First of all, we have vaccination. And we have mainly two vaccines that can protect us from cancer. They are two types of cancer caused by viral infection. The first one is the hepatitis B virus. This was once one of the main causes of liver cancer, since it lives in the liver and it causes a chronic state of liver inflammation, leading to cirrhosis and later on to liver cancer. This vaccine is applied at birth, 2 months and 6 months in the Mexican vaccination chart. Other countries have a slightly different regime or time of the vaccinations. However, in almost every country, it's birth and a couple of months after birth. Then we have the HPV vaccine, a much newer vaccine that has, however, shown a very strong impact on the frequency of cancer, and specifically cervix cancer. The HPV vaccine is applied at 9 to 45 years old. The ideal scenario is to apply it in young people, young girls and young boys, because if we give the vaccine before there has been a contact with the virus and before sexual relationships, then we have a much stronger response. However, once again, even adults that have already an active sex life can benefit from this HPV vaccine. Also noteworthy, in some countries, girls are the ones vaccinated, since they are the ones with the highest risk of cancer associated with HPV. However, boys can also develop cancer, can also have an infection. There are a lot of types of cancer caused by HPV in men. So boys are also really benefit from the application of the HPV vaccine. Number 2, we have diet. And in this, of course, we are constantly eating. If we eat well, of course, we are protecting us from cancer, mainly gastrointestinal cancer and colorectal cancer. If we eat bad, we are increasing our risk. So in this traffic light, we have the red traffic light showing foods that we should almost completely avoid. Here we have processed meat and sausages. These are a known carcinogen, and when we eat it, we increase certain toxins in our colon and rectum, leading, of course, to colorectal cancer. So ideally, avoid these types of food. A new type of product that is starting to show its carcinogenic potential are artificial sweeteners. There are some studies showing that they increase the risk of certain types of cancer, mainly aspartame and isosulfame K or potassic. These two are commonly found in mainly beverages like soda, that is sugar-free, And the evidence is not as strong as, for example, sausages and processed meat, but the evidence is also mounting. So every year we get a little bit more evidence that artificial sweeteners may cause colorectal cancer and other types of cancer. Once again, I don't want to leave the message that we should already avoid it at all cost. However, if we can avoid it, it is definitely healthier to avoid it. However, important to mention, changing to sugar is not better. So drinking all of the, for example, soda. If we are right now consuming artificial sweeteners because we like the sweet taste of the beverage and we change to a regular soda, this doesn't improve our results in cancer prevention because high intakes of sugar is also a leading factor of colorectal cancer and other types of cancer, and we're going to review it a little bit further. In the yellow light, we have red meat. Red meat can be healthy at certain doses. We can consume up to 500 grams per week, and there is no increase in cancer risk with this dose. Of course, a lot of things in this world are red meat. Meat that comes from pigs, from cows, from lambs. All of that is red meat. So it's easy to go over the limit, but if we stay under the limit, we are safe. The other one is milk. Milk, of course, for children is very healthy and very nutritious. However, adults do not need milk, so we can just avoid it. But if we really like milk, we should prefer low-fat milk, since the fat in milk, especially in adults, in female adults, has shown also weak evidence, but evidence that increases breast cancer frequency. And finally, our green light is, of course, all of the foods that we should be consuming a lot. First of all, we have fiber. Fiber is all of the things we don't absorb from our veggies and our fruits. And it's really good to wash away all of the toxins that our colon and our rectum may be filling up with. So a lot of fiber in our diet is very, very good. Also a lot of antioxidants, a lot of citrus. This, of course, is, once again, fruits and vegetables. The more we consume of these types of food, the more protected we are. And finally, coffee and tea have also shown a protective effect in the risk of colorectal cancer and gastrointestinal cancers. Number 3, we should definitely avoid alcohol. Alcohol is a toxic substance. There is not a safe dose when we are talking about cancer. And the types of cancer that may cause, of course, the liver cancer is the most known one, because once again it causes the damage in the liver. It may lead to cirrhosis and then liver cancer, but it also can cause mouth, esophagus, larynx, stomach, and colorectal cancers. All of those, of course, kind of obvious, because these are structures within our body that are in contact with the alcohol. And once again, alcohol is a toxic substance for our cells. However, we should also remember that when we start metabolizing alcohol in our liver, it transforms into another thing called acetaldehyde. And this is also a carcinogen and a toxic substance. It then goes into our bloodstream and it touches a lot of our cells, also increasing the risk, of course, of malignant transformation and the appearance of cancer. One of the best examples is there is an increase in risk when we consume alcohol of breast cancer. Now, alcohol, despite there not being a safe dose, there are some recommendations of alcohol consumption, because it's, of course, very popular and many people are not going to just leave it. So the recommendation is no more than 350 milliliters of beer, 150 milliliters of wine, and 45 milliliters of liquors, of stronger beverages with a higher percentage of alcohol. Number 4, we of course should also avoid tobacco. Tobacco is even more toxic than alcohol, and it causes, of course, a lot of cancers in our respiratory tract, with very frequent cancers in mouth, esophagus, larynx, and lung. However, just like alcohol, all of the toxins that we are breathing in through smoking also reach our bloodstream and also reach all of our tissues. And thus, we also find a very high increase in the risk of colorectal cancer, breast cancer, bladder cancer, and leukemia. There is not any type of safe dose of tobacco. We should just quit smoking. However, a very interesting point is, of course, that a patient that has even years of smoking that stops smoking, we see a very important decrease in the risk of cancer when the patient stops smoking. So even if we have a patient a long-time smoker, quitting smoking through drugs, through therapy, through all of the interventions we have available, really protects those patients from all of the cancers that we can see on the screen right now. Then we have a healthy weight and physical activity. Every person should be with a BMI between 18.5 and 24.9, or easier to measure, a waist less than 40 inches in men and 35 inches in women. Why is that? Because, of course, abdominal fat is going to transform. It's a type of tissue that starts secreting some hormones, mainly estrogen, cortisol, and some pro-inflammatory hormones. And when we have many years with that abdominal fat, of course, those hormones run amok and they start being toxic to our cells. And they can, of course, generate some types of cancer called obesity-related cancers, where we can find the breast, liver, colorectal, ovary, endometrium, and stomach. All of these, once again, because of the things that the abdominal fat produces. Now, as a separate mechanism of protection, we need 150 minutes per week of mild activity. I want to make it very clear, these are two different mechanisms for protection. This means that a patient that, for example, has obesity but does physical activity is more protected than a patient with obesity without the physical activity. And we also find the effect the other way around. A thin patient, or a patient that has a correct BMI but does not do physical activity, is in a much higher risk than a thin patient that does the activity. So we should strive to do both and to do it as frequently as possible. Next, we have Helicobacter pylori eradication. This is, of course, a bacteria. It's a very common bacteria. Most people in the world are going to have it in one moment or other of their lives. It usually translates in chronic gastritis. So we have a lot of acid reflux, we have a lot of gastritis, and this even if we have a correct diet. And that's because of the infection. The patient then thinks it's because of the coffee, stress, or some other thing. He or she doesn't get tested, and the bacteria then can hurt our stomach for prolonged periods of time, and then leading to cancer. What should we do? Of course, we should have a diagnostic test. It's pretty easy to diagnose it. We can have an urea breath test, and we can also have an antigen on feces. We quickly detect the infection, and then we can relatively easy treat it. With a combination of several antibiotics and antacids, we can eradicate the infection from patients, and this, of course, decreases the risk of stomach cancer, because the main cancer associated with Helicobacter pylori infection is, of course, stomach cancer. On the next point, we should avoid ultraviolet radiation. This is, of course, mainly from the sun. We should use a sunscreen with an SPF. This is the amount of UV rays that bounce off the sunscreen, of at least 15 when we are doing like regular activities, going to the office, driving around the city, other types of things. When we are going to be more exposed to the sun, so if we go to the beach, if we go to a park and things like that, we should strive for using an SPF of at least 30. We should apply the sunscreen every 4 to 6 hours, depending on the amount of sweat and the amount of activity we are doing. We should also try to avoid the sun between 10 a.m. and 4 p.m. because that's the moment when there is the most ultraviolet radiation from the sun rays. This is also kind of complicated because ultraviolet radiation, it's very harmful for the skin, but it's also necessary for our bodies because ultraviolet radiation is the main driver in our skin to produce vitamin D. So we should try to have some sun, but mainly outside of these hours, once again from 10 a.m. to 4 p.m. and no more than 15 to 30 minutes per day. We should also avoid, of course, direct ultraviolet radiation from other sources. Some of the common ones are tanning beds and gelish, this technique of painting the nails when we at the end expose the nail, of course, to ultraviolet radiation, thus increasing the risk of skin cancer in our fingers. So we should, of course, try to avoid those artificial sources of ultraviolet radiation. We should also try to detect early a cancer. If we find a cancer when it's just starting, it's almost always curable and the patient goes on to have a long and healthy life. But when we detect cancer much more advanced, it's very frequently a death sentence. There is nothing that we can do, and the patient just progresses with its disease. So there are a couple of studies, very important, to detect a cancer when it's starting, and we should all remember them and try to do them as we need to do them. First of all, the Papa Nicolau. This is a test, a swab of the cervix of women. This is done a year after sexual activity, after the beginning of the sex life. This is going to show us which cells are infected with human papillomavirus, and thus if we need to do any other treatment to destroy those cells infected and prevent them from becoming a cervical cancer. Even a patient that has the vaccines should get tested for HPV infection and the Papa Nicolau, because right now there is still a very high frequency of these types of infection. Maybe in a distant future, when most of the patients or most of the population is vaccinated and the frequency of HPV infection is really low, we can skip this study, but right now it's really essential, and we have to do it depending on the information that our gynecologist tells us, but every year to every 5 years. Then a mammogram, of course, this is going to help us. It's a radiograph from the breast tissue in patients 40 years and older. This is also done every 1 to 2 years, depending on the conversation between the gynecologist and the patient. And it's going to show us very early lesions of breast cancer. These early lesions can be, once again, easily treated, and the patient almost always recovers. If we don't detect those lesions, then the cancer, of course, increases, it advances and progresses, and it may be very late when we find it. Next one is the colonoscopy. Colonoscopy is when we take a camera and take video and pictures from the inside of the colon. This is going to show us not only polyps and tumors in our colon, but it may also detect other pathologies like diverticuli, inflammatory diseases, and even in some cases parasites. The colonoscopy we have to start when we are 50 years old, and depending on the information our physician gives us, it can be done again every 5 to every 10 years, depending on the results that we found. Then we have the prostatic antigen. The specific prostatic antigen is, of course, a protein that our prostates produce. And when it's really elevated, it can show whether a prostate cancer or, of course, other diseases from the prostate gland, from prostatitis to benign prostatic hyperplasia. This has to be done from 50 years old, and once again, depending on the information our doctor gives us, every 2 to 5 years. And it's usually accompanied by a digital exam, so an exploration of the prostate gland that shows the physician, of course, the hardness of the prostate and the risk of having cancer. And finally, skin checkups. When we have new lesions, when we have new spots and things, we should go to our dermatologist to get them checked and make sure that they are not a skin cancer. Number 9, we should avoid contaminants. All of the contaminants we can avoid. There are some that are really complicated, others are not so much. Number 1, gas stoves. We now know that even a properly working gas stove is going to produce contaminants in our homes, and of course when we use them, even more. And the air pollution from the city, of course, the burning of gasoline from cars is also going to create these same types of contaminants and fumes in a smaller concentration than a gas stove. A gas stove is much more concentrated because it's inside our homes, but air pollution is also very bad for our health and increases the risk of certain types of cancer. And finally, radon exposure. Radon is, of course, an radioactive gas. It is present in some places of the world. It comes out of the soil, so mainly in the lower parts of buildings, there is some risk to radon exposure. The good thing is you can get tested. You can test if there is radon in your home or in your office. And if there is, there are several ways we can diminish the risk and diminish the exposure to radon. But we have to know that this is a risk, and we have to know that this should be tested. And finally, avoid other carcinogens. And here I am talking mainly about drugs, prescription drugs that increase the risk of cancer. We are going to do very soon another video talking about those prescription drugs, and I am going, once the video is on the channel, I'm going to leave the link up here. But of course, some of the main culprits are some of the drugs that we prescribe for gastritis and for heartburn, and also some hormonal drugs. So things for the management, for example, of menopause, some contraceptives, some drugs, of course, to treat cancer can also increase the risk of a second cancer. So all of this, we're going to review it later on. And finally, these are the 10 ways to stop cancer. Number 1, vaccines, diet, avoid alcohol, avoid tobacco, have a healthy weight and physical activity, Helicobacter pylori eradication, avoid ultraviolet radiation, early detection, avoid contaminants, and avoid carcinogens. This is basically information. Thank you very much. These are the references, so you can check them out. And as always, help us change the world. Share the information.